even if you have a family history of diabetes and hypertension, this should even motivate you more, right? Because you like, oh, but I have this in my family, so I'm going to get this. That is not true. You know, a genetic predisposition does not mean that you're going to become that, right? That environmental aspect of it, which is almost half, you know, in the habits that you form, are just as important as the genetic predisposition to something, right? Genetic predisposition does not mean, unless you have a very strong component like breast cancer that's going to cause breast cancer, that only means that you have a higher likelihood based on the environment that you lived in and the culture that you come from. But those are things that can be manipulated in a positive way and modified so that you can continue your cultural ethnicity. We just need to teach you ration control and what is good in your diet that isn't necessarily eating 6 tacos at a mealtime or eating high carbohydrate foods, you know, at every sitting. By incorporating more protein, incorporating more minerals, incorporating more vegetables, and showing you how your own diet can be used in your favor rather than against you. You know.
Right, and just because your family has dealt with certain health conditions does not mean that it has to be your fate as well. It's just we're changing that narrative because so many people think that just because it's in their genetics that they will then suffer the same consequences, but that's just not true. And we're proving that through this program is that you can work on your lifestyle with the right support and accountability in place. You can make changes happen relatively quickly. We're seeing results in less than 3 months. This is innovative for a lot of people because they've never actually had this type of support and didn't even know if it was possible. So the level of confidence that we're instilling in the patients is, I think that in itself is invaluable because they're actually in the transformation themselves.